the role of the Principal Secretary and Cabinet Secretary in the 758 million and 7.1 billion procurement, and as follows. On the 758 million, Chair and Honorable Members, which is part of the 1 billion, which was provided by the World Bank, the Ministry and the World Bank jointly agreed on the budget and the procurement plan based on priority areas in mitigating COVID-19. The Ministry subsequently formally requested KEMSA to undertake the procurement and delivery of commodities to national and county facilities. With respect to the 7.1 billion, the Ministry has no role at all in that procurement because these funds are related to the KEMSA capital funds. The role of the Cabinet Secretary in this matter was to provide policy direction for the bilateral support from the World Bank. And with respect to the Principal Secretary, the role is to, number one, requisition the funding from the World Bank. Number two, make requests to KEMSA to procure items on behalf of the Ministry based on the needs analysis and available resources. And there's an Annex 1, which I will come back to. And finally, based on the needs analysis, give the distribution instructions to KEMSA for the procured commodities that are funded through the Ministry of Health. Chair and Honorable Members, allow me to go to turn to Annex 1, which is attached, so that, Chair, we can walk you through how we have managed and prosecuted the procurements as relates to the 758 million. Chair, on 18th of March, as you can see in the attachment, we gave instructions, or we requested KEMSA to undertake procurement of those following PPE items, N95 masks, and some laboratory sample transport collection consumable kits. And Chair, this was followed by specifications, which were then later sent to KEMSA. On 19th of March, and again, Chair and Honorable Members, this is when we had the very, very first cases of COVID being reported in the country. On 19th of March, again, following a meeting that had been held with the laboratory team and the resource mobilization team of the National Task Force for Coronavirus, a decision was therefore made to procure commodities for COVID-19. And it was in this regard that, in addition to the request we had sent in 18th, that we required to procure 6,000 laboratory test kits, which included the laboratory supplies and reagents. And the Chair and Honorable Members, that was provided for, again, as we instructed the KEMSA to procure. Again, on 23rd of March, the Ministry again wrote to the CEO of KEMSA, and again refers to the National Emergency Response Committee on COVID-19, which had met on 21st of March, and where it was agreed that there was an urgent need for us to procure 30 ventilators to serve both the adult pediatrics and then also universal disposable tubing and accessories. And we also gave an estimated cost of what was said to us would be the presentation remains the same as the one that they had made on 1st and 2nd of April, which is the items description, the unit of measure, the supplier, the quantity ordered, the unit price, the total cost. So it's a complete replica of their submission of 1st of April, but only that this time they have rationalized it to fall within the budget that the Ministry had set, and which really we had funds for. So my biggest concern was that we do not make commitments beyond what is not available, because again, that would be in contravention with the public procurement laws and the PFM Act. So, Chair, following the receipt of this letter, I then now wrote to the CEO of KEMSA on 15th of April, now confirming to them that we have various items that have been identified and approved by the bank for the procurement of KEMSA, and now I was communicating to him that we have approved procurement of goods worth 758 as outlined in the attached annex. And we go further to say, disregard all the other requests made in relation to COVID as they have been captured under this approval. And Chair, why this was necessary, and honorable members, was because looking at what had been procured and what the ministry had asked for, actually the institution had gone way beyond the request. So at that point, it was just a question of capping them at 758 million so that we could be able to process that. And so, Chair, using the very document that they had submitted to me on the 7th of April, outlining the rationalized budget, I went ahead to give them the approval. And so, Chair, if you look at the attached document, which contains the details of the order, and which has been going around and claimed that the PS gave instruction, Chair, you can see that word for word, this is really a replica of the copy of the rationalized budget that came from KEMSA. So, Chair, this is to say very categorically that at no time did the ministry submit a list of suppliers from which KEMSA would buy. What the ministry did was to simply adopt the rationalized budget, because remember at that time we were in the middle of a crisis, but on the other hand, we had to ensure that we spent what we had available. Chair, going on further, just so that we understand the context at that time, on the 22nd of June, 2020, I received a letter from my colleague in the National Treasury. And my colleague makes reference, Chair, if you can read the letter dated 22nd June 2020, it's from the National Treasury. And it says that this is in reference to the letter of KEMSA dated 2nd June, seeking for budgetary support amounting to 5 billion to facilitate payment for the health products and technologies to cater for the distribution to public health facilities and other institutions providing COVID-19 related services. KEMSA has indicated that in consultation with stakeholders, it mobilized COVID-19 emergency supplies worth 5,140,946,000, with a view to mitigate potential supply shocks and far-reaching COVID-19 implications. However, we note that KEMSA has not provided information of whether the commitment was made without confirmation of availability of funds from the ministry. The above notwithstanding, it is noted that KEMSA has addressed this request directly to the National Treasury and Planning, therefore bypassing the Ministry of Health. KEMSA is advised that such requests should be channeled through the Accounting Officer, Ministry of Health. Further, since the National Treasury does not have any scope for additional funding, the ministry is advised to use the resources available for COVID-19 in the year 2019-20 budget. So, Chair, you can see now here KEMSA is coming to the reality of overcommitting, and now they have committed up to 5 billion. And Chair, I want to also be very categorical to say that the ministry was not aware of, that such a commitment had been made. And perhaps that's why the letter had gone directly to the National Treasury and not through the ministry. So, Chair, you can see there the next letter is a letter that actually had originated from KEMSA to the CS of the National Treasury, seeking for finances to be able to meet this cost that they had incurred of 5.14 billion. And they go on further in the attachment, Chair, to list the items that they had procured, all the way from KN95 face masks to the VTMs and all the other items that are listed there, totaling 5.14 billion. So, Chair and honorable members, when this letter was received at the ministry, I then wrote back on 2nd of July to KEMSA. And I made reference to the letter that had come from the National Treasury on 22nd June 2020. And here we noted to KEMSA again that, KEMSA had sought for budgetary support from the Treasury to facilitate the procurement